So here we are 1 week after taking out a tooth and doing some sinus procedures and a few implants. I'm just going to ask you a few questions. How did you do during, after the treatment, and over the course of the week?
I had no real problems. Followed all the instructions, took the medicine at the regular intervals, used the Periodontics on the sore parts of the gums, and there really were no problems. The only problem I had was watching how I ate and made sure I only ate on the opposite side. And as you can tell, I like to eat, and that was the only problem, was being careful not to chew on it. And other than that, there was no real annoyance. One little suture was hanging down a little bit, and it felt a little uncomfortable, but that was easily cut off and cut shorter, and that's it. There were no problems at all.
Well,
I had an infection before I had the implants and the other work done, and that sort of settled down. I know that the gums feel swollen now, but there is a marked improvement over the way it was before, and there's no real signs of infection. I've been on antibiotics for almost 2 weeks.
So tell me, you had a little anxiety before the procedure?
Yes, I did, but
How do we do during the injection process and the treatment during the treatment?
Everybody gets a little tense when you know they're going to stick a needle in your gums, but it numbs up pretty quickly, and it's like in any other local anesthetic. As soon as it takes, you don't feel anything.
And during the course of treatment, you didn't feel anything?
No, not really. Maybe a little tenderness in the gum, just be outside the area that was anesthetized, but really not anything, no real sharp pains. As a matter of fact, I went home and I took one of the recommended painkillers, and I was still numb. I never felt any pain, and I never took another one. I didn't need anything for pain.
And there is absolutely no swelling, and the tissues are healing wonderfully. And I expect a positive result, as usual. So we have a 98% success rate with implants, and in about three months we'll probably punch you on back down to the restorative doctor so he can create the crowns and the bridge work for you.
That sounds good. And like I said, anybody who's worried about pain and discomfort and that, I have a cousin who is an old-time periodontist, one of the original periodontists here in the South, and one of the things he's always proud of is that patients almost never experience any pain at all, no less the monstrous pain they think they're going to have. It just doesn't happen because an anesthesia is so good, and the doctors are skilled at putting the anesthesia in the right spots to block the nerves, and it's not as uncomfortable. The only uncomfortable thing is keeping your mouth open for the time of the work, and that's part of the nature of the beast with dentistry.
Well, with our treatment, we took out a tooth, did a sinus procedure, and a few implants, and I think it only took us, by the time you came and left, about an hour and a half, not that long.
Right, it was quick. It was very quick.
We try to be efficient.
Well, Dr. Gornstein, to me, seems to know what he's doing, and that's a good testimony in itself, because
coming from a doctor like you, that's a very nice thing to say.
Perception is an important matter, and if you have a little bit of knowledge of the related fields, you can understand it better.
We thank you for being such a great patient.
Right. I can't say it's my pleasure, because it isn't. The procedure isn't a pleasure, and the costs aren't a pleasure, but the pleasure is going to be when I'm able to eat well and not have to worry about my teeth there. I've always had very good teeth, but this was generated by two broken teeth, because I must have bitten down hard on something and had a bridge over that. The bridge didn't break, but the teeth broke, and that's how accidents happen. And it's fixable with these implants. It's a nice procedure.
Thank you very much.